On page 5 of the calendar is Senate Bill 1560. Representative LaPointe. Mr. Clerk, read the bill.
Senate Bill 1560, a bill connecting mental health, third reading of the Senate bill.
Representative LaPointe is recognized.
Thank you, Mr. Speaker. Senate Bill 5060 is the third bill to come out of our Illinois Children's Behavioral Health Transformation Initiative. And this is our initiative that improves behavioral health access for youth who have significant behavioral health challenges by streamlining how families access care and streamlining our resources. So the initiative overall is led by our Chief Behavioral Health Officer, and it brings together our 6 child-serving state agencies. We've had 3 bills to come through this initiative. This is the third bill, so 2 of them are already law. This bill specifically gets us closer to implementing universal mental health screenings in Illinois public schools, grades 3 through 12. There's been precursor work to this bill, of course. So specifically, the bill requires ISB to make available resource materials for schools to implement universal mental health screenings, including model procedures and guidance, AKA model policies, and that's by September 2026. The bill provides that the mental health screenings shall be offered by school districts to students in grades 3 through 12 at least once a year and beginning with the 2027-28 school year. The bill details that the provisions will only be effective for the years that the state through ISB has successfully procured a screening tool that our school districts could use for free. Of the utmost importance, every single school district with this bill has to offer a universal mental health screening, but every single family and student can opt out. So there is an opt-out provision. School districts do have to offer the universal mental health screenings, but parents and guardians and students themselves can opt out. There is another part of the bill that pertains to making sure our hospital providers are trained on our Beacon portal. But I think people are most interested in the mental health screening. So I'll leave it at that, Speaker, and I'm happy to answer any questions.
For discussion, Representative Reich is recognized.
Thank you, Mr. Speaker. Will the sponsor yield?
She indicates you will.
Representative, we had a real good conversation in the last committee informally on this one, and I'd like to put some of those questions that I put to you there onto the record. First of all, what's the difference between the type of screening that we're doing now in most of the schools here in Illinois and what you anticipate this screening to be? Where do they differ? How do they differ?
Yeah, that's a great question. So because there were precursor work to this bill, including a landscape scan of what all our school districts are doing for mental health screenings, we know that about 28% of our school districts in Illinois are currently using a mental health screening, and then an additional, and that's universal, meaning that they are kind of having a mechanism to use the screening on every child at least once a year. An additional 40% of schools are using some kind of mental health screening, but not necessarily universal. So that's what's happening today, but I do want to be clear that a mental health screening is a screening. It's not a clinical assessment at all. It's like a tool that we use to discern if kids are at risk and if they have deeper behavioral health issues. But it's almost like a cursory tool that is used.
Okay, I'll accept that. Who will be conducting these screenings? How will they be conducted?
So the bill is not prescriptive on who at the individual school district's level will conduct these screenings. However, what we also know, and this came out in an amendment in the Senate, is the screenings are intended, and the model that ISB will use for its model policy, they're actually intended to be self-assessments, which is one of the reasons why the grade level was moved up from, it was going to be like, K through 12, and now it's 3 through 12, because third graders are actually capable of doing a self-assessment.
Can you describe what is a self-assessment?
And I just used the word assessment, and that was an error.
I'm sorry.
Screening.
We had this problem. Yes. If I say assessment, I mean screener.
There we
I'm
go.
sorry. It just seems to slip out.
We've got clarity. So for a younger person, like in 3rd or 4th grade, it could even exist on a tablet where the young student answers a series of questions, maybe even with graphics that say, I am feeling happy, I am feeling sad, I am feeling worried. It could be as simple as that, Rep.
Thank you, Mr. Speaker. Okay, so it can be done on a tablet. Will these results of this screening then be captured electronically? It seems that they would be.
I mean, if the screening was done on a tablet by design, they are captured electronically.
But, okay, if they're not done on a tablet, how are they going to be captured?
Well, the only other way I know other than a tablet or e-device would be on paper.
I'm sorry.
The only other way I can think of, if it's not on an e-device, would actually be on paper.
On paper.
And this is going to be up to the districts because, as you know, ISB will put out a model policy by September 2026. But it's a model policy that ticks on some things that the local school district's policies have to address, but the model policy is not going to be a 5-point guide of what the school districts have to be, so there's a lot of discretion left up to each individual school district.
So, okay, you just swerved into something here. You say that the individual school districts will be given the opportunity to adjust what has to be assessed? Is that what you said? Or was I mistaken?
I'm trying to, the school districts will have to implement a universal mental health screening in their schools.
Okay.
And what the model policy at ISB will say, and what is actually in the bill, is it points to what has to be included in, not the screening itself, but in the process of setting up universal mental health screenings in schools. So for instance, the whole mental health screening process at the district level will have to include the option to opt out. It will have to address confidentiality and privacy concerns.
So you're talking about process here in this regard. Okay,
yeah, there's
great.
no prescription for what the actual screening itself has to include.
Okay, very good. What safeguards are in place to protect confidentiality here?
So there'll be some model guidance coming from ISB in September in 2026. And that will just be model guidance. So I can't tell you prescriptively exactly what safeguards for data privacy will exist, but what I can tell you is this is something that our school districts deal with every day right now. As you heard me say, 28% of our school districts today have a mental health screener, and they have data privacy policies on the books. All our school districts have lawyers that are currently managing this.
Okay, I had our staff person pull a random sample of different types of screenings that are done among various schools around the state, and I'm assuming that what you're doing is you're taking all of these different screeners and you are compiling what you consider to be the proper screenings on a grade level out of these questions and other questions that are other things that may come to light, excuse me, in the meantime. Am I correct on that?
Well, ISB already undertook a landscape scan of the current mental health screeners being implemented right now across Illinois, and then they have until September 2026 to actually procure a mental health screener that school districts will be able to use for free, although they don't have to. School districts can also use their own mental health screener.
But they have, do those individual screeners that are being used by school districts have to be approved by ISB pursuant to the screener that you're going to use as your model?
I don't know the answer to that question, Rep. And that's a question that could pertain to the bill, but it could also pertain to the screeners that are in use today at school districts around the state.
Let's move over to the content of these screenings. What are we going to focus on? What questions are we going to ask? Do we know what questions are going to be asked within these screenings? And how are you going to do that from a 3rd grade to a 12th grade level?
Well, as I described before, and I will fully admit, I am not an expert on mental health screenings that are in use or will be in use in the future. But screenings seek to discern if a student, in this case grades 3 through 12, are at risk for behavioral health issues, or are having current behavioral health issues, or are having socio-emotional issues. And the whole point of a screener is to just identify issues early.
Okay, then.
A possible next step would be a school social worker actually has a conversation with the student.
Okay, who's going to connect the dots between the answers that are given on that screening and moving over to a conversation with the school social worker or counselor? Somebody's going to have to do what will commonly be referred to in my lingo as an assessment. Who's going to make that determination?
That would be up to the school district to decide.
So the standard screener is something that is going to be statewide, but the school district is going to have its own determination as to whether or not the answers on a particular child's screening rises to the level of something that requires intervention by a school counselor or a social worker?
That's a fair characterization of actually what happens today. I mean, there is human discretion involved in almost every single thing that happens in life.
Mr. Speaker, may we move this to standard debate, please?
We are now on standard debate.
Thank you, sir.
But if you can bring your questions to a close, that'll be great.
I'm sorry.
But if you can bring your question to a close, that'll be great.
This is a pretty important bill, Mr. Speaker, and I'm asking for some latitude here.
Thank you.
We don't know the questions that are going to be asked. I mean, what will be the, if I'm looking for depression, if I'm looking for self-harm, indications of future self-harm that may be part of a diagnosis, these are kinds of things that I think we deserve to know. How deep are we going to go into these screenings in order to determine what we think will be a proper way to assess a child's risk toward future mental health problems?
What you're describing would play out at each individual school and in each individual school district. And a school or a district would have a protocol for that. And a screener is a pretty cursory first step. But in terms of having an actual protocol for who exactly at a school or at a district level is looking at the data from the screenings, each individual school district will be building up their protocols for that. And to be clear, we have 28% of school districts that are currently doing this.
Thank you. To the bill.
The bill.
There's no question in this state that we have a mental health problem among our youth. Sources are peer pressure, bullying, something that even somebody as old as I had to put up with when I was in grade school. But now social media, radical culture change, things like that have made it even worse on today's kids than it is in previous generations. Our children are being torn in ways that could not have been imagined and are questioning not only who they are now, but what they are or why they are here. A big reason why our children are being torn by the fact that they are constantly confronted with discussions of depression, personal inadequacy, and stories of self-harm, and are glued to social media that paints a false picture of the rest of the world having a great big party that they haven't been invited to. Being impressionable, kids are going to take this internally, and they're going to do things to themselves, or they're going to internalize them in ways that move their mental acuity and their mental health in different directions, ones that we haven't anticipated. Yes, we need work on this sort of thing. And on its face, this whole idea of mental health screening is a good idea. It's a good idea, but not in this case as far as, for reasons I'll say. The devil is in the details. These screenings are geared toward identifying potential issues based upon answers given to specific questions. It's only fair to ask, what are the areas of concern to be addressed? We're not able to be given the answers here. We don't know. The specific questions, how they be adapted for different grade levels, we don't know. For instance, will third graders be asked if they know someone who's committed suicide or has contemplated suicide, or if they've contemplated suicide themselves? We don't know. To say that these assessments or these screeners will conform to some standard of best practices is not enough, since I've seen too many instances of best practices being developed to satisfy the demands of one constituency at the expense of others. I'm not saying it's happening here, but in today's superheated climate, it's better that all the cards are laid face up on the table. The bill also provides that on or before September 1, 2026, the Board of Education, in consultation with the Children's Behavioral Health Transformation Team in the Office of the Governor and relevant stakeholders, which in very backhanded way do include parents but are not specifically mentioned in this, shall report on work and the resource materials, including model procedures and guidance to phased approach to implementing universal mental health screening in schools. It doesn't specify to whom the report shall be made. The General Assembly is about to pass a bill, because it wouldn't be here if it hadn't already adhered to the Welch Rule. We're about to pass a bill that's stepping into the dark. We're asking schools, we're demanding that schools start giving prospective diagnoses, and I'm going to say diagnosis or assessment based upon a screening. If you're having your vision tested or your hearing tested in school,
Representative, please bring remarks to a close.
Please, Mr. Speaker, may I have just a few more minutes? Thank you. This is important. This is an important bill. You check for astigmatism, you check for a pierced eardrum. The kid can't hear, the kid can't see, the kid can't color within the lines, and he's disruptive in class. This is not something like that. We're looking forward. We're looking at something that might happen in the future and put children in a position where they're answering questions that maybe they're not ready to answer. And one final thing here. Representative,
unless someone wants to yield their time, please bring your remarks to a close.
Thank you. Thank you very much.
Representative Tipsora gives you his time.
One final thing to close. This bill provides for parents to opt out of mental health screening. What we're doing here is we're telling schools to go ahead, unless we opt out, we're telling schools to go ahead and do a proscriptive assessment or screen that might put kids in a situation where this information is going to go forward throughout their entire school lives and maybe even beyond. This is a bill that demands an opt-in. Parents can easily overlook an opt-out, like during the busy time when they're signing their kids up for class, they may have an option to opt out and don't even consider what it is they're opting out of or allowing to happen. This is a bill that requires parents' involvement, at least to the extent of opting in. If COVID taught us anything, it taught us, or it gave us a diminished respect for the institutions that we used to rely on in this country, schools and the public health system being one of them. Frankly speaking, I also don't believe that confidentiality can be easily maintained on these kinds of things. Parents need the opportunity to feel like they are being brought into the process, at least to the extent of an opt-in provision on this bill and not an opt-out. For those reasons and others, which we won't go into now, I strongly urge a no vote on this bill. Thank you.
Representative Grant is recognized.
Thank you, Speaker. To the bill.
Bill.
Forcing school to administer yet another screening, especially using a one-size-fits-all tool developed by the state, raises serious concerns about labeling, privacy, unnecessary anxiety for families, especially as young as third grade, even fourth, fifth, sixth. We all want to support children's mental health, but this mandate oversteps by pushing complex diagnoses, diagnostics into our youngest students without strong evidence or local control. Let's take parenting out of the public schools and bring it back home where it belongs, with parents. Thank you.
Representative Niemerk is recognized.
Thank you, Mr. Speaker. Will the sponsor yield?
She indicates she will.
I just have a couple of quick questions. Who will be developing this mental health screening and the language in the mental health screening?
ISB will be procuring a universal mental health screening tool that school districts will have the option to use, but they will also have the option not to use that tool that ISB has procured, and they will maintain the option to procure their own tool at the district level.
Okay, so the school district will have the availability to use whatever mental health screening they feel is appropriate to that school district.
Yes. I want to point out a nuance here, Rep. Yes, they will. If they use the tool that ISB procures, it will be free to the school districts. There could be a cost if they go out and find their own tool that costs money. There might be other mental health screenings out there that there is no cost. I'm not an expert on every single mental health screening out there in the world.
Okay, thank you. Now it also says, in consultation with the Children's Behavioral Health Transformation Team of the Office of the Governor, will they be assisting ISB?
Yes, they've been working with ISB, and in fact, all our 6 child-serving agencies on the much larger Illinois Children's Behavioral Health Transformation Initiative for the past few years.
Okay. And you had said that, like my son or daughter could opt out of this mental health screening. How will that be made available to me as a parent to know that my child is going to have a mental health screening at their school?
That's a great question. And I'm going to be very, very clear about this. So for the school districts that aren't doing this already, when this officially comes online from the state's perspective, every single school district will have to have an opt-out policy that you're aware of. The nuances of exactly how that policy will be communicated to parents and guardians will be up to the school district.
Okay, that particular portion of the bill does concern me quite a bit, because there could be a situation where I'm not made aware in a timely manner, or not made aware, don't really know what's going on with this mental health screening, and my kids are not going to come to me and say, "Hey, Dad, they want to do a mental health screening on me tomorrow," and then tell me what's going on. That's not going to happen. So my concern is we have another state agency, especially with how volatile the issues are, very contentious issues on social issues, that some parents might have moral issues with questions that are being asked of their children. And I just have some major issues with that. Like the previous speaker said, it should be an opt-in. And I'm also concerned, I guess one last question. Will will these mental health evaluation questions, will they be made available to the parent via website, anything from the schools before that they're administered to the children?
It's a screening, not an assessment
Well, I
or an
apologize.
evaluation. There's been a lot of contention about that, so I just want to be clear every time I can. So a few things in response to that question. The nuances of that, well, let me back up. So that larger topic will be addressed in the model policy coming from ISB. But just like I said, in terms of the nuances of the opt-out policy, that will be addressed at the local school district level. They will have specific policies related to that.
Okay. Will the readout?
Please bring your remarks to a close.
Yep, last question, Mr. Speaker. Will the readout of what transpired, what my child is asked, and my child's answers, will that be made available to the parents?
So it's a simple question, but there's not a simple answer. We do have laws on the books in Illinois today that kids 12 and over can seek mental health treatment without their parent or guardians being notified. That is current law today in Illinois. So as you can see, that law is going to intersect here with the students that are being screened who are over 12 years old. Okay. Will parents be able to get the results of the mental health screenings for sure for kids younger than that? Those policies will be worked out at the local school district level.
Okay. Thank you. This is a very dangerous piece of legislation that removes parental rights, and I'd like to ask for a verification, please. Thank you.
For further discussion, Representative Favor-Dias is recognized.
To the bill.
Bill.
I just wanted to give my thanks to Rep. LaPointe for all of her leadership and work on this bill. I want to highlight a couple of things that I think this bill has been really thoughtfully crafted. One, we hear so much from our school districts about the burdens and the mandates that we place on them, but she has been really careful in crafting this language to make sure that the state board is leading on this issue by offering guidance and support in creating this model policy. Which they have to do by September of 2026. Then they don't even have to begin implementing these screenings for another year. There is a statewide procurement process of a universal screening tool that districts can use at their disposal. So we are giving them guidance. We are giving them support. It has been in partnership, in collaboration with mental health experts. So our schools will be getting some of the best resources possible to create a really robust program that addresses our kids' mental health needs. As she has mentioned, there is a parental opt-out, and so parents have flexibility. If this is not for them, then they can choose for their child not to participate. And then it also offers a really generous ramp up for implementation. So all those things that we hear from our districts over and over again about cost or lack of guidance or a state mandate that doesn't provide leadership, this bill addresses all of those things in a really thoughtful and skillful way. And so thank you, Rep. LaPointe, for all of your work on this.
For further discussion, Representative Leader Morgan is recognized.
Thank you, Mr. Speaker. Will the sponsor yield?
She indicates she will.
Representative LaPointe, I'm not sure all of our colleagues heard a lot of the discussion, so I was hoping to kind of drill down a little bit more. Can you remind us, I heard some discussion about whether this is kind of a screening versus a test. Can you break this down of exactly what this is? It seemed like some people were really, really concerned, but it just seemed like we were just trying to help out identifying those with mental illness. Can you break that down again of exactly what we're doing here?
I sure can, Rep. Morgan. A screening is very different than in a mental health evaluation or a mental health assessment. A mental health assessments can actually take a few hours to do. There are things called biopsychosocial assessments that actually go really deep to help figure out what the symptoms are that somebody might be dealing with, and assessments point us in the direction of what a treatment might be. A screening is, relative to an assessment, actually pretty cursory. The whole point of a screening is to, in a pretty quick way, figure out if this person's at risk. Does this person need another touch? And in the context of a school, a very normal response to a screener that identifies some level of risk would be that the school social worker has a conversation with the student. And I wish that happened more often in schools, but as you know, some of our schools don't even have a full-time social worker.
Yeah, and so tell us about that. I mean, my child's younger, in second grade, and so this is particularly for younger children, correct?
This bill in particular would make sure that we have universal mental health screenings in schools grades 3 through 12 in Illinois.
So no, that was a great clarification, because I think everybody in this chamber would agree, and to the bill, Mr. Speaker.
To the bill.
Thank you, Representative LaPointe, for bringing this bill. As we're talking about the epidemic, and it is an epidemic of mental health that is plaguing our children throughout the state, regardless of what district you're in, I would have thought it would have been an agreed upon principle that we would all want to help identify mental illness and support our students when necessary and wherever we can. So I understand a lot of people with a lot of feelings. Feelings are what we're doing at the end of May, but this seems like a really straightforward piece of legislation. I know it's going to help my students, my children. I urge an aye vote. Thank you.
Members, just a reminder, we are on standard debate, and we've heard from 3 in favor and 3 in opposition. Representative LaPointe to close.
You said to close?
Representative LaPointe to close.
Okay. Thank you, Speaker. I love seeing you up there, by the way, former Vice Chair of the Mental Health and Addiction Committee. This has been a good debate. I knew it was going to be a good debate because this bill is on the action alert of one of our wonderful organizations called the Illinois Family Institute. But I want to point out that at the end of the day, having universal mental health screenings in schools is about prevention. It is about prevention. And yes, indeed, as we heard talked about on both sides of the aisle, we are in a mental health crisis, frankly, for our adults and certainly for our youth. And the whole point of having universal mental health screenings in schools that families can opt out of is to catch issues earlier. And the harsh reality is, and this was pointed out by our U.S. Surgeon General under the previous administration, that for young people, it takes an average of 11 years from the onset of their behavioral health symptoms to when they can actually access treatment. And a part of that statistic is our lack of access to mental health support in schools, where almost every kid goes. Not all, but almost, many. This is what this bill is about. Catching issues earlier, connecting people to support and treatment earlier. And these screenings, if they are indeed universal, which is the point of the bill, will weave it into the day-to-day of schools so students won't feel othered. They won't feel like, oh, I'm doing my mental health screening, because a lot of kids will be doing it. And that's actually a good thing, if you ask me. And the last thing I want to say is, as Rep. Favor-Dias said, there's been 3 precursor bills. This is the 3rd bill in a series, and there's been so much precursor work. The work to get to universal mental health screening in Illinois has been incremental. It has been thoughtful. Dare I say it's been slow. Sometimes a little too slow, but there's a reason for that, because we want to get it right.
Thank you, Representative LaPointe.
Thank you. I urge an aye vote.
Members, Representative Nienberg has requested a verification. All members will be in their chairs and vote their own switches. The question is, shall Senate Bill 1560 pass? All in favor vote aye, all opposed vote nay. The vote is open. Have all voted who wish? Have all voted who wish? Have all voted who wish? Mr. Clerk, take the record. On this question, there are 72 voting in favor, 36 voting against, 0 voting present. Mr. Clerk, please read the names of those voting in the affirmative.
A poll of those voting in the affirmative. Representative Andrade, Representative Avalar, Representative Benton, Representative Blair Sherlock, Representative Briel, Representative Buckner, Representative Canty, Representative Cassidy, Representative Chung.
Representative Nienberg is recognized.
Thank you, Mr. Speaker. I'll withdraw my verification.
Thank you, sir. On this question, there are 72 voting in favor, 36 voting against, 0 voting present. The bill having received a constitutional majority is hereby declared passed.